Better in, better out in cardiac surgery. An increasing number of elderly people are undergoing cardiac surgery. Less invasive cardiac surgery techniques allow more vulnerable patients to survive cardiac surgery procedures. However, more than 1/3 experience delirium, depression, pressure ulcers, or infection after the operation. To reduce the risk of complications, the patient should prepare himself or herself in the period before the hospital admission. The nurse plays an important role in this preparation. Once cardiac surgery is indicated, the patient consults the nurse. This consult consists of 3 parts. In the first part, the nurse informs the patient about the procedure in the hospital. This is performed on 3 levels: the procedure in the hospital, what the patient will experience, and what the patient and the family can and should do. These last 2 levels give the patient more control during hospitalization. The patient and family are informed that cardiac surgery requires a considerable amount of energy and that the patient should eat well and even follow an energy-rich diet in advance. During the admission period, daily visits from loved ones support the recovery of the patient. Often the patient experiences pain after the operation. Proper pain treatment is needed for recovery. The nurse emphasizes that the patient should ask for painkillers if necessary. In the second part of the interview, for each complication, the nurse checks whether the patient has an elevated risk. This is performed on the basis of 4 short score lists. One example of a risk factor for delirium is the use of a walking stick or a walker. In addition, people who are physically limited develop pressure ulcers more rapidly. In the third part of the interview, the nurse presents preventative measures. For all complications, the patient and the family are asked to really focus on the early signs of the possible development of these complications. Signs of depression include a dejected feeling and loss of concentration. And signs of an infection include pain at the site of the surgical wounds, in the respiratory tract or in the bladder. Other preventative measures are discussed with the patient. To prevent delirium, tools for orientation should be used. For example, the patient should bring a clock or calendar from home and use his or her own glasses or hearing aid immediately after surgery. Preventative measures for depression include receiving daily visits from loved ones and bringing a device with relaxing music to the hospital. Preventative measures for pressure ulcers and infection include pain control and breathing exercises. With good support provided by the nurse, the risk of complications can be reduced. The interview is therefore the first step in getting prepared for a successful hospital stay.